Good afternoon, everybody, and thank you for joining us for this webinar on our new VITLdirect secure messaging product. I'm Steve LaRose. I'm VITL's Vice President for External Affairs, and I'll be the moderator for today's webinar. Our presenter today is Michelle LaJoyce, who's our outreach specialist and who's been working on this VITLdirect product. We also have on the phone with us Larry Gilbert, who's our Director of Outreach and Business Development, who may chime in from time to time especially to answer your questions. So before we begin, I just wanted to mention that we are interested in your questions. Very much would like to hear your questions as Michelle goes along with her presentation. And you can ask questions in a couple of different ways. One way is you can click the raise your hand icon, which is on your control panel. And what that'll do is it'll tell me that you are interested in asking a question verbally. So if you're on the phone and you've entered your audio pin, or you're on the internet and you've got a headset or something like that, and you want to ask your question, you can do it that way, or at any time you could always just write your question into the questions box here and it'll pop up on my screen, and then when we get to a point where we're going to stop and take a few questions, I'll read off the question for Michelle. So with that brief bit of housekeeping out of the way, I'm going to switch over to Michelle, who will take us through the rest of the way. Go ahead and show your screen, Michelle.
Okay. Well, thank you for joining this afternoon, maybe bypassing your lunchtime. Just want to provide a little caveat. I am fighting a cold, so if you hear any sneezing or coughing, I'm trying to keep it out of the microphone, but it might happen. So today we're here to talk about VITLdirect. I thought I'd start out with a bit of an overview of the product, talk about some of the benefits, and then just launch into a demonstration. It's a very basic product. It is email, essentially, but delivered in a HIPAA-compliant manner. So what is VITLdirect? This is just kind of a short little spiel. HIPAA-compliant tool that provides users within a trusted network the ability to send and receive clinical data in electronic format. So what does that mean? In Vermont, we're in process of building a VITLdirect network. Currently, there are a small amount of users. Those users have the ability to send HIPAA-compliant messages in a secure manner to one another. In order to become part of that network, each side needs to have signed up with VITL, and they become a trusted user. Some of the benefits of joining the network include, and I'm just going to kind of go through these quickly, and in between this and the demonstration we'll have some time for some questions as well. So it can save time. It may be faster than faxing or traditional mail. It can eliminate the need for fax machine or phone lines. So if you have information that you typically have to fax for a referral or fax discharge notes, that information can be sent securely using VITLdirect. It's also a better quality. Sometimes when you receive a fax, it's a little scrambled. The resolution may not be so great. This is pretty good quality image that you're receiving. Automatic notification. You have the ability to set up within your individual account whether you would like to receive notification via email or text whenever a message arrives. We do understand that this product is not something that you will have open, such as your Outlook or other tools that you are using. You may be using it a little less frequently. So this can provide an alert mechanism to let you know when you have a new VITLdirect message. Can improve patient coordination of care, meaning if you are working in a team environment where there are multiple providers, billing contacts, maybe you're working with nurses, PAs, This tool can provide a tool to allow you to share information about your patient. It can save time getting up to scan, fax, pull patient charts. Can be time consuming. Having it on your desktop or laptop can save some time. And as mentioned, it is HIPAA compliant. It's encrypted service. And it allows you to communicate across organizational borders with and without an EHR. So you may work with some practices who have already adopted an electronic health record, maybe some who are in process, and then some who are sticking with their paper. This tool can allow you to share information with all of those parties. And then it does provide the ability to achieve stage 1 meaningful use by sharing clinical data through VITLdirect. And it's currently being offered at no cost through June 2013. So those are some of the benefits. Types of data that you may be sharing: referrals. You'll see that you have the ability to create templates, patient summaries, discharge summaries, perhaps lab results, some images that you may want to share. Basically any protected health information, so any PHI, and that's just kind of a brief description of what that includes. So even if it has some basic payment history that includes the patient information, that is considered PHI, and it's something to take note of. You want to make sure that that is sent in a secure, encrypted manner. So I am going to move on to the demonstration. I think Steve is going to open it up just for any preliminary questions while I'm transferring over.
Okay, thanks, Michelle. Yes, so far, anybody have any questions, you can either put them in the questions box, and I will see that, or you can certainly raise your hand, click the raise your hand icon. We did get one question about audio. If anybody other than Richard is having some audio problems, let us know. It sounds pretty good to me. I am monitoring it, Richard, but it may be just your connection. I'm not sure, but if anybody else is got bad audio, let me know and I'll see what I can do about it. So Lindsay has a question about whether there's a list available of what practices or doctors are currently using this program. Glad you asked that, Lindsay. I'm sure that Michelle will talk about the address book when we go through the demo, but why don't we give Lindsay the quick answer, Michelle?
Sure, Lindsay. So if you sign up for the tool, there is the ability to view the other people who have signed up within, sorry, make a drink here, within Direct. And I've had this question before. We don't actually, we haven't kind of put together a list that's available online or just to be distributed, but once you're in Direct, that'll be an easy thing for you to view. And two ways to do that. Number one, when you're composing an email, direct message, this will look very similar to those of you who are using Gmail or Outlook. Once you start to enter in information, so you're looking for a name, they will populate, and you will only see people within the VITLdirect network being populated. So that's one way that you can view those members. The other way, as Steve started to mention, is by looking into your address book. So the address book actually is a comprehensive list, and if you look at this, these are some of the providers here. You can also, this list will, as we grow, will start to get larger. It's alphabetical, so you can also search if you're looking for someone in particular. That's one way to do so. And what you'll also notice as you're looking at your address book is that you have the ability to see not only the contact but also the practice. So you'll see St. Johnsbury, Evergreen, etc. And those are the two basic ways to view members of the VITLdirect network. So in order to grow the network, and you do have the ability to invite people into your network. These are ideally people outside of your network. So if there's someone that you're typically faxing referrals to, or that you would maybe like to receive discharge summaries, you have the ability to invite those users. You enter in their basic information. They're sent an email, as are we. We follow up with them to let them know what the product is and find out if they're interested, and this is the information that's sent along with that. So this is one way that you have the ability to help to grow that network. Hope that answers your question.
Okay, thanks, Michelle. And there's another question here from Kathy, and that is, does this feed into our current email, or is this separate?
Great question. It's currently separate. This product is Java-based. It's something that is installed onto your desktop or laptop, and not web-based at this time. So it's not, you do not have the ability to integrate it into Outlook or Gmail. It is a completely separate tool, and the reason for that is that we have built a network of trusted users, so that you know that the person that is sending the message and receiving both have been qualified by VITL as a provider, someone who needs to be in the network. So it's not an open source type of messaging tool.
All right, and we should mention, Michelle, about how you can set up a notification so that you are notified, say in your regular email, that something is waiting for you to look at in your VITLdirect secure messaging system. Can you talk a little bit about that?
Absolutely. So in the introduction, I kind of talked about that notification. So I'll go ahead and start the demonstration, and I'll start there because that's a great place. So across this, as you can see, this is your basic VITLdirect window. Here is your workspace, and I'm noting that term workspace because this can be utilized as your workspace for yourself as an individual. It can also be shared with your group. So if you're a practice of 4 or 5 or more individuals, you can choose to share with individuals or the group, and they can choose to share with you. And you have the ability to view messages that have been sent, received, and also things like screenshots. So you have the ability to capture information or images that you have shared. So I just wanted to point out that this is your workspace because I'll be talking about that throughout the demonstration. To reference to Steve's notification, so pretty basic menu options, but we will start here under Tools and your profile. So one of the first things that you would do if you decided to use VITLdirect would be to set up your profile. Profile is your basic information. Some of this gets pulled in during the registration process. Your settings, these are some basic settings. Let me expand out this window. I mentioned that you have the ability to share. So the members of your organization, you can share, and it's a one-way process. I can see whom I've shared with, and they're not necessarily sharing with me. Just some basic settings. And then notifications. So this is what Steve was mentioning and I mentioned earlier. This, again, is most likely not going to be an application that is open 8 hours a day during your hours of operation. So what you can do is allow the system to send you a notification either by email or text when you receive forms and secure messages. And it does ask your cell carrier, but it's pretty basic. And what happens when you receive a secure message, it does not give you any secure information, so it wouldn't give you the content of that message. It would just say, you have received a secure message, and then you can go and you can sign in. But it allows you the ability to have that, a little bit of portability and flexibility. Let me close this out. So to kind of continue on demonstrating some of the features, again, very similar to email. For those of you who are using basically any other application, a lot of this is going to look very familiar. There are some additional features that you can use, but it's very similar. So this is your workspace, as I mentioned, across the top, across the side, your inbox, sent, so you can view any sent messages. As you will notice, there's not, it currently does not have the ability to create like individual folders. However, you can search. So as your inbox, or if you start to archive items, if you ever need to go back and make a reference, you can simply search. You can search by patient name, maybe type, maybe if you're looking for an x-ray. Yeah, I guess I do. There's some x-rays in here. So you have that ability to really get in there and look for some information that may be helpful. Across the top, you do have the ability to refresh. So sometimes if you capture a screenshot or you're saving an image to your workspace, it's not necessarily immediate. So if you refresh, you'll see that information. Compose, I already mentioned this. This is how you would start to create a message. Selecting one or multiple recipients, entering your subject, very similar. Direct also allows you to create templates. So I'll show you where that happens in a moment, but this is an example of a template that you may want to share. So if you have a practice that you typically send referrals to and it's a standard format, you can create that within Direct, complete, and distribute. And also this can be shared with your group. You have the ability to attach, so again, very similar to standard email. So you could select any type of document to send. And then you also have the ability to select. And select, the difference between attach and select. Attach allows you the ability to attach a document from your hard drive, so any document that you have saved. Select are those documents that you have saved into your workspace. So it could be an image that you captured via screenshot. It might have been a document of an image that you saved. It just allows you to select any of those documents or images from your workspace. And actually, let me do one of those, sorry. So once you select an image, built into VITLdirect is an image editor. This is just an example of, say, a lab results. You can edit. Maybe you want to write some text, make a note. You also have the ability to capture your signature. If you wanted to make a note and then sign, you could do that. Oops. So I did a couple times. There's some Mickey Mouse signatures there. You have the ability to notate and edit these images as needed and then send them. And you can save, and then that would be sent. So that's a little bit about composing. We talked a little bit about your address book. Again, this includes members of the VITLdirect network. You can also create filters if you were looking for a specific type. Much of this will look familiar to you as in any other type of email tool. Under here, capture screenshot. This is kind of a neat tool in that if you are using maybe an electronic health record, you have a couple of options if you want to share information out of that EHR. You can actually set up VITLdirect to be a printer, and we won't go into that too much right now because it's a high-level demonstration, but during a training we would show you how to set that up so that if you had a clinical summary that you wanted to print, rather than print to a standard printer and then scan it so that it would be an image to share with VITLdirect, you can actually set VITLdirect to be a printer where you would print to VITLdirect and then it would show up in your workspace. Another way to capture that information and share is to use this screenshot save. So you'll see this window is created, and I think I have a image here. So if you had a image that you wanted to share, or clinical summary, or anything that you can imagine. You resize to your needs, select OK, and then that image will be available in your workspace. And you can see that I used to have 2, now I have 3. So that image that I just captured is now available to be sent. Also, anyone in my group that I'm sharing my workspace with will also be able to view and utilize these screenshots that I have shared. So that can be an interesting tool. The image editor I already mentioned, that allows you to take your images. You can add your signature, notate as needed, etc. Your profile we mentioned. The signature that I showed you, I did Mickey Mouse. That is set up by you. You have the ability to take a piece of paper, write your, create your signature. Sorry, I'm waiting for that wizard to pop up. There we go. And this actually walks you through that process. So you would scan it into the system, save it, and that would become your signature. And that Mickey Mouse that you saw earlier is the product of that wizard. Your templates. So I showed you in the compose an email demo part the actual product. This is where you would set up those referrals. So you can see there's some active, inactive, if you need to make any changes. So if the practice that you were regularly referring with needed to make a change or add an additional field, you could do so here. Very basic text templates. And again, they're shared within your organization. And then finally, I think one of the most, this is a fairly simple product that it is email, essentially, sent in a scripted manner. There is an online user guide. It's in a PDF format, so you have the ability to save it to your desktop, and it's always available. And some of the things that I've mentioned today are in here, as well as introduction to adding VITLdirect as a printer. But you'll see sending a message, using a template. It's a really dynamic tool that just provides pictures as well as basic instruction on how to utilize the tool for you and your practice. And that is pretty much it for the demonstration. I'd like to open it up for questions, and we can go into more detail as needed.
Okay, great, Michelle. We do have several questions, which I'll be reading off to you in just a moment. But before we do that, I'll remind the folks listening and watching that you can ask questions either by clicking the raise your hand icon in your control panel, your GoToWebinar control panel, and that'll let me know that you want to ask your question verbally, and then I'll try to unmute your line. Or you can, as several other people have done, you can just type your question into the question box, and then it will show up on my screen into the queue, and then I can read it off and get an answer. And I'm going to, now that we're into the Q&A, I'm going to unmute Larry and let Larry chime in on some of these as well. So the first question comes from Ken, and that is, how long do messages get retained in VITLdirect?
I'm going to defer to Larry. And by retained, do you mean within the inbox or archived?
I'm going to guess that Ken means in the inbox. He says either.
Okay. And I don't know the specifics in terms of when they are archived. Larry, do you have more information on that?
Yeah, I think that they only go into the archive when you put them in the archive. Otherwise, they'll just stay on your desktop, I believe, pretty much indefinitely. I don't know that you would want them there, just like you wouldn't want emails from a year ago clogging any system that you have. So I have not heard that there is an expiration date. It's a good question, and I think maybe we can get an answer for you if you give us a give us a little while.
Okay, thanks, Larry. So the next question comes from Troy, and who wants to know, are you able to only send email to other VITLdirect members, or can you send to external recipients, and are they allowed to view the content? So I think that goes back to the question of this being a closed system. Michelle and Larry, maybe you can elaborate on that. But we also might want to take this as an opportunity to try to explain the direct system, and also how we in the future anticipate messages being able to go to other direct users in different systems in parts of the country.
You want me to take this one, Michelle?
Sure, yeah. Sorry, I was just jumping down.
Okay, so the direct system is actually a national, based on a national standard, and HISPs, health information or health internet service providers around the country are developing these systems. So there will be people with direct compliant addresses at many places. So, for instance, Microsoft Health Vault, which is a PHR for anybody, any consumer can have a Microsoft Health Vault account. Microsoft Health Vault is a direct compliant secure email system, and so a person with a Health Vault account could communicate with a VITLdirect account user. And so as these HISPs develop nationally, for instance, we are just starting to work with the states of New Hampshire, Massachusetts, and New York, so that providers in Vermont can communicate this way with providers in those states. But for right now, we are only responsible for Vermont providers, and we are working to establish the connections so providers can go out of state as well.
Okay, thanks, Larry. So, Troy, I think the short answer to your question is, for right at the moment, it can only VITLdirect members, only other VITLdirect members get to see the messages that you would send. But as Larry just explained, in the future, we anticipate that messages will be able to go to other folks who are using direct compliance systems as well. And I see that Troy has sent me a message saying that that explanation does help. So appreciate that, Troy, that feedback. So the next question comes from Barb, and that is, can I attach and send a CCD, which is short for a continuity of care document or a clinical summary, that can be attached to an electronic medical record? So Michelle, do you want to take that one?
Sure. So if the CCD comes in a like a PDF or an image format, which I think currently it possibly would, you can. It's just looked at as a document. And back to that compose, you have the ability to attach those types of documents. So if it's a standard, if you have the CCD as an output document where it's visible, it's human visible information in a PDF image, whatever that might be, you can certainly attach it and send that document in. What it does not allow you to do is, if you're looking for a means to kind of import-export data from one system to another, I don't think that this would probably be the best tool for that. But in terms of visible information sharing, like the clinical summary, CCD, that type of thing, I believe it would work. And I don't know if, Larry, you have anything to add to that.
No, it's an image that you send. Unfortunately, it does not allow for discrete data import or export.
Okay, thanks. And Barb, hopefully that answered your question. If it didn't, you're welcome to send us a follow-up question. The next question comes from Ken, and that is, can you download attachments to your local system? And I'm going to interpret local system to mean your computer desktop. You can let me know, Ken, if I misinterpreted your question. So Michelle, can you, I think he says that is correct. Michelle, can you maybe explain how to do that?
Sure. So if you're receiving an image, you can open, you have a couple of options. You can open as a PDF, and then you can save. So that's one way. You could save it as a PDF or a document, and this can be saved on your hard drive under any folder that you need, or if you have a shared drive. And that works the same if you are, so if somebody, say, captured this image from their image viewer system, they sent it to you, you would then just open it as a PDF, save it to your system, and then you could technically attach it in your EHR if you had one, or you could save it in a file system that you have available.
Okay, thanks, Michelle. Mm-hmm. And Ken says thank you as well. He says that was perfect. The next question comes from John, and John, and I'm going to say we may not know the answer to this even before I ask the question. We'll give it a shot. John wants to know, will this work through RDP? And he says that means Windows Terminal Services. Does anybody know the answer to that, Michelle or Larry?
I'm not the technical expert here, but I believe that it will, John. We've tested that, and it worked on one system. So I'm going to say yes, but it'd be really easy to test it on your system if that's something you'd like to do.
Okay, great. All right. Thanks, John. And let us know. He says thank you. Okay, great. Next question comes from Jeffrey, who wants to know, is it possible to record the number of patients whose information is exchanged in this manner in order to meet a percentage of for compliance?
I'm not personally aware of any reporting capability that this tool has. I'm not sure if you've heard anything about that, Larry.
I have not.
But that's something, I mean, I can note that as a question.
And I'm guessing that Jeffrey is interested in this because it might be like a criteria for meaningful use or something like that. Is that, Larry, do you know if that's...
Well, so you could use this for exchange of clinical information for meaningful use in terms of aggregating the number of patients. I'm uncomfortable sort of hazarding a guess here, so I'm gonna say I don't know.
Okay, Jeffrey. So that's probably it doesn't sound like we could actually print out documentation. You know, you might be able to make some sort of notation and track it in another system somewhere, perhaps even a spreadsheet. I mean, what we could do is we could put you in touch with one of our EHR implementation specialists who very much know this meaningful use, if that's what you're shooting for, and they might be able to give you some additional guidance there. The next question comes from Lindsay, and that is, does this program work for Mac users? Michelle?
My understanding is yes. The basic capability is that you have the ability to install Java onto whatever tool you're using. So I believe, I haven't worked with any Mac users, but I don't think that there should be any problems because of that Java application. I don't know, Larry, if you've worked with any Mac users.
No, I'm in the PC world, I'm afraid, but I don't know why it would not work on Mac. So. Okay,
great. Thank you both. So Troy is providing us with a little bit of information about the question about the Windows terminal systems, and I think it goes to remote access and whether somebody could use this if they were remoting into their office computer and being able to open up the VITLdirect system. And that might be a good jumping off point to talk about how this does work, maybe spend a few minutes getting under the hood. Michelle mentioned that it's a Java download, and so can you tell us a little bit, Michelle, about exactly what goes on? I see you have the VITLdirect sign up and download screen up here, so maybe we can get into that a little bit as to, okay, I'm interested, I want to either try it out or I want to use it, so what happens after that?
Yeah, and I actually brought this up to provide maybe some clarity to the previous question as well, because it does say on here Windows, Mac, operating systems, and Linux, and that just that it has to be Java 1.6 or higher. So I thought it was on here, I just wanted to double check. So those are the basic requirements for usage.
Okay, so when somebody downloads this, it does stay on their computer desktop, and do they have to be physically in front of that computer to actually use it, or could you use some sort of a remote system? There are a number of them out there that allow you to use a remote access to control your computer remotely.
I haven't had that experience yet. I know, I think that, Larry, you mentioned you've worked with the virtual environments.
Well, we tested it. We tested it on a system, and it appeared to work. So, but that was just a test. So I'm going to dash over to talk to our technical folks and see if they have any insight they can provide on this that's a little more clear than what I've given.
Okay, great.
Sure. And in the meantime, so the way that the majority of our users so far have utilized the system, they have downloaded it onto desktop, laptop, a standard system with those requirements. Typically, they are instructed to update their Java. That is one thing that tends to pop up. And then there is an icon on your desktop. So it is located on your physical computer. And I've had a couple of people ask me questions about tablets. It unfortunately is not available in a web-based format. It does have to be downloaded, so that there are some restrictions in terms of the tool that you choose to use it on.
Okay, thanks, Michelle. And why don't we take the opportunity to, I do have one more question here, and that has to do with, can an organization use this as a shared mailbox? So, for example, the medical records department, perhaps using this to communicate with other members of the organization or internally, that sort of thing, or even perhaps with other organizations. So can you tell me a little bit, Michelle, about how people can actually use this?
Sure. So it's not necessarily designed to provide communication within an organization, something like, say, an intranet. However, that being said, if you are using the tool within your organization to share PHI to users outside of your organization, you can use this shared workspace as a means to share that information as they come in. So much like your fax machine, the fax machine sits in your office, and several people from your staff, maybe your receptionist, your people from billing, or providers can go to that fax and access the information. This shared workspace does provide that same format. It's not really to communicate with each other. However, you may currently have a process in place where say a referral comes in, a nurse reviews it, and then a provider needs to sign off on it, or something like that. So you do have the ability to set up your workspace so that those 2 or 3 parties can view that information. And maybe one has to look at it, one has to sign it, and maybe another one has to respond or print it out, or whatever that is. So to to the part of sharing within your organization, absolutely. As a tool to send information to each other, that's really not what it's designed for. It's designed to send PHI to people outside of your organization. However, we do recognize that sometimes that takes multiple parties. So that's where the sharing comes in. Hope that clarifies.
Yeah, and Ken, actually, while you were speaking, Ken sent me a clarification message, and he's thinking is using it as a single point of contact from his organization to other providers, such as fax machines have been used in the past, where you have like a single fax number, incoming and outgoing messages go through that, and then they get distributed to others in the organization.
Sure. So thanks for the clarification. And actually, we do have the ability to set up. We can set up individuals with direct addresses. We can also set up your practice as, say, info.direct.vital.net, so that your practice has an address to send to, much like your fax machine. So great question, and thanks for bringing that up. And yes, we can do that. Okay.
And so Troy has asked a question, and it may have already been clarified, but let me give it a shot here. And that is, if we had 3 receptionists, could they use the same login and all 3 be signed in simultaneously, or would each receptionist need separate logins? And I know the answer to this, surprisingly, but I'm going to let Michelle go ahead and explain it.
So yes, as with any secure system, we always definitely recommend that each user have their own username and password, just because you want to have that audit trail, you want to have that accountability, and to the earlier response, again, we can also have that generic email so that multiple users can use. But if you have 3 receptionists, you at minimum want to have 3 usernames and passwords, and we can set those up quite easily.
And Troy says, great, thank you.
And no Post-it notes with their passwords.
So no Post-it notes. Our security expert, Lowry Scharf, is always reminding us, no Post-it notes. So let's see here. Michelle, why don't we go ahead and talk about the registration process? There may be a few more questions that come in, but I don't have any right at the moment, so this is a good opportunity to talk about how to go about getting this and signing up.
Absolutely. So the first thing one of the first things you want to do, the address is up here. It's direct.vital.net, and this is what the pages that you will see will look like. That was a lot of words, but only one person from your organization needs to actually create the VITLdirect account. Once we have set up the organization, there is a form that we send you that allows you to enter in all of the users, and we can register the users for the organization. And the only reason I mention that is because if you have multiple people within your organization registering for the product, they may put in different organization names, and there's multiple entries. So we really just need one person from your organization to make that first registration. In addition to that, we do require that for individual users, there is a business associate agreement that is reviewed, signed, and sent to us. And for organizations, we have a services agreement, which is a document which we would need reviewed and signed and sent to us, just to, again, because there is some protected health information involved with this product. There needs to be some protections on both sides. So those are 2 agreements that need to be completed. And then after that, once your account is set up, the rest of your users simply go to this website. They select Download Now. That Java application is loaded onto their system, and they can sign in. We issue usernames, which is your email, and passwords, and you're ready to go. We do provide training. If you need it, we can do it via the web, or we can come in person, do individual or groups. So there's some flexibility in getting your staff up and trained. Anything to add to that, Steve?
No, I don't think so, Michelle. I think that was a great explanation. So we don't have any questions at this point. So I think probably what we're going to do is wrap it up by thanking both Michelle and Larry for taking the time out to give us this demo. And thank you, Ken, for your participation in questions as well. Actually, I do have one person who's raised their hand, so I'm going to give this a shot. So the other Michelle, your line is unmuted. Go ahead with your question.
I was just wondering, you said that it was free until June of 2013. What is the cost after?
Great question, Michelle. And so Michelle Joyce, why don't you explain that? What's the situation there?
Sure. So the price after June 30th, so beginning in July, will be $10 per user account. So if your practice has 3 users, it would be $30 per month, and we are currently charging by the year. So it would be $360. I'm doing some fast math in my foggy brain, but that will be the price after the end of the free use up until June 30th. And it's a free trial, so you have the 6 or almost 7 months now to use the system, see if it makes sense, and continue using it, or you can cancel before then.
Great. Thank you very much.
Okay, great. Thanks for asking that question, Michelle. Really appreciate it. Okay, so unless there are any other questions, we will wrap it up a few minutes before our scheduled end time. But that's good. Give everybody a chance to go off and do stuff this afternoon before the weekend. So again, thanks to Larry and Michelle from the VITL staff, and also thank all of you who have been listening to the webinar. Really appreciate your time today, and have a great weekend.